Hello, my name is Dr. James Pilkington. I'm a board-certified urologist with AdventHealth Medical Group in the Polk County market. Today, we're going to be talking about something that affects a large amount of men as they get older and can have significant negative impacts on their quality of life, and that is BPH, or benign prostatic hyperplasia. So today, we're going to go over what is benign prostatic hyperplasia, better known as BPH? What are the available treatment options? And why should I consider a novel treatment called aquablation? So first of all, what is the prostate? It's a gland that plays an important role in male sexual function. And during a man's life, the prostate will grow and to some degree can grow abnormally and cause problems with urination or other health problems. A prostate that's grown larger than normal is considered BPH. The cause is unknown. BPH should be considered separately from prostate cancer. Some symptoms that may arise from an enlarged prostate or BPH can involve problems with holding or storing urine, as well as problems with emptying the bladder. Some symptoms of storing the urine that a man may experience include urgency or having to go suddenly without warning, frequency or going more often than normal, nocturia or having to go throughout the night, or incontinence or inability to keep the urine in. Some symptoms of emptying the bladder that may arise include straining or having to push to empty the bladder, burning or stinging when urinating, having trouble starting the urine stream, a weakened urinary stream, a stream that starts and stops, or even an inability to empty the bladder. These things can negatively affect a man's quality of life. Diagnosing BPH may take several different tests. First of all, you may have a physical exam done on your prostate, also known as the finger test. We'll review different symptoms you may be having, and you may also undergo some other investigations, such as looking in the bladder with a camera or measuring the prostate with ultrasound. 99% of men do report that BPH impacts their quality of life negatively. The management of BPH depends on symptoms and patient preferences. It can range from watchful waiting to medication or even surgical options. Watchful waiting means just watching and seeing if symptoms worsen. It might involve changing some of your behaviors, such as watching what you drink or peeing on a schedule. However, this is not going to necessarily affect the progression of the disease or prevent further damage from happening. Oftentimes, men are prescribed medicines as a first line for BPH and symptoms that are happening because of BPH. Medications can have side effects, and some of those could be long-term. For example, a quote from Howard, a 68-year-old male, reported that medications he was taking for BPH seemed to have side effects. They were causing more harm than good. It wasn't helping my flow. It wasn't helping me sleep through the night. Over time, even if drugs work, they might stop working and symptoms may worsen. Additionally, medicines might not prevent further damage that is happening from blockage your prostate is causing. Some of that damage could be irreversible. The last options for management of BPH are surgery. There are different types of surgeries that are offered for management of BPH, and sometimes that depends on patient preference, the size of the prostate, the shape of the prostate, as well as other factors. There's non-resective prostate surgery where no tissue is removed. Oftentimes, these are same-day procedures. Some you may have heard of include UroLift or Resume or prostate water vapor therapy. These oftentimes have low rates of irreversible complications. However, they're used more so for smaller prostates, and they may not have that durable of an effect. There are also resective prostate surgeries where tissue is actually removed to open up the channel that you pee through. Oftentimes, these require overnight hospital stays. They're generally used for larger prostates or patients who are having more severe symptoms, oftentimes lead to longer-term relief. They can have higher rates of irreversible complications as compared to some of the non-resective prostate surgeries. Some examples include transurethral resection of the prostate, better known as TURP, different types of laser surgeries, or even more invasive open or robotic surgeries. What I'll be talking more about for the rest of the presentation is aquablation. It is a type of resective surgery in order to open up the prostate. This combines long-term relief of a resective surgery with lower rates of irreversible complications and can be used in a large array of prostate sizes. So, a little bit more about aquablation therapy. It is a robotic procedure that removes prostate tissue using a powerful water jet. It's the only procedure that uses a heat-free water jet controlled by robotic technology. It provides precise, consistent, and predictable results. It can be performed on prostates of any size, and it has low rates of irreversible complications. It has 0% incidence of negative impacts on erections or orgasmic function, sexual desire, intercourse satisfaction, or overall sexual satisfaction. 90% of men who undergo this procedure preserve ejaculatory function, and 99% of men with BPH did not have incontinence after treatment. So a little bit about how the procedure is performed. Only aquablation combines a camera and ultrasound imaging to create a real-time detailed map, avoiding sensitive areas that could lead to irreversible complications. This here is a video that outlines some of the mapping that we do before we start the procedure. As you can see on the screen, we're able to see the prostate very well, and we're able to plan our resection or removal of tissue in the prostate. This helps us make sure that we're not damaging vital structures and that we're removing enough tissue. This is an overview of the actual procedure itself. And as you can see, the robotic water jet goes back and forth to actually remove tissue with high pressure. And this is monitored closely with real-time ultrasound to ensure that enough tissue is being removed and no vital structures are being damaged. Ultimately leaving a nice open channel. So why should you consider aquablation therapy? First, it has low rates of irreversible complications, as we're able to have a good view of the prostate and have real-time ultrasound guidance throughout the procedure, and it uses no heat. There's confidence in the procedure because it's robotically controlled, which ensures precise, consistent, and predictable prostate tissue removal, and oftentimes provides long-term relief. What to expect after aquablation? Patients will typically stay overnight in the hospital. Most patients will go home for a few days with a catheter, which is removed in our office. There are some postoperative symptoms that vary from patient to patient, but most patients will experience some mild burning, some frequency or urgency during the few days to a couple of weeks after surgery. Patients can resume their normal activities once approved by their doctors.
When you first start having the problem and you got to go, the worst part is you stand there and you can't go. I'm 62, really active. I take really good care of myself. There was really no easy solutions. But it happens to be a urinary tract problem that could ultimately lead to an erection problem or a sexual dysfunction problem. Everybody says, welcome to the club, and I don't want to be part of that club.
Ed's always been full of energy and larger than life. When I noticed that he was not the same, I knew that the BPH was causing him a big problem. He just wasn't as engaged.
BPH, benign prostatic hyperplasia, essentially is an enlargement of the prostate. And in simple terms, when it starts to get enlarged like that, you can't go pee. When I laid down, it seemed to put more pressure on my bladder, hence I would get up almost every hour on the hour. You can imagine what it does to your sleep. I mean, literally towards the end, it became just like having a bad nightmare. And I find myself getting a severe lack of sleep. Well, that affected my mood, my stress levels. It seemed to cause me constant worry because it was always on my mind.
When the person you love starts to change, it's an unsettling feeling. It started to affect things that we were doing. I mean, intimacy has been a really big part of our relationship, and that was definitely affected.
But ultimately, you kind of mask over what's going on, and I think we try to kid ourselves that I can deal with this. But once you get into a medium to severe BPH problem, you really don't have much choice. You're going to have some type of surgery. The meds don't work at that point. I did all the research possible. I mean, I went on every website quizzing the doctors, and I found out that there's probably 3 or 4 different procedures. They all have potential side effects. And in men's health, I don't think this is something anybody should fool around with. I really didn't want to compromise. When I came across the Aquablation, I realized that I didn't have to make those compromises. All I had to do was make the choice. For me, it was a no-brainer to go forward with the Aquablation.
The procedure overall was quick. He didn't have any complications.
I could not believe the result that I had. It was immediate. I forgot what my real freedom was like. I had no problems, no side effects from a sexual standpoint. And it's just amazing that I don't think about going to the bathroom anymore. It was like not only just treating me, but treating my life, my lifestyle. It gave it all back to me again.
Now he's back to his old self. It's actually changed our relationship for the better. It's just completely different. And we've completely reconnected. I'm really grateful for that. I have my best friend back. You don't have to grow distance in your relationship because of something like BPH. For anybody out there who's going through similar things, I would not hesitate to look into this procedure.
It's so different now. I mean, to say it's a 180 is an understatement because once you've been on both sides of it, it's life-changing and life-altering. It's freedom. Boy, let me tell you, I made the right decision.
So if you want to learn more about BPH and potential treatment options such as aquablation, please give us a call and make an appointment. Thank you.